Welcome to my Educate channel. I'm Dr. Ricardo Giustra, plastic surgeon, Buenos Aires, Argentina. I'm specialized in facial rejuvenation, natural rejuvenation, and minimal invasive procedures that get an incredible result without scars. Today I'm going to talk about as I return to the face is youth and natural beauty. The following is my personal technique. Here you can see my curriculum from general surgeon, professor of medicine, chief of plastic surgeon, and member of different international societies. This patient came to my office looking for full face facial rejuvenation. And if we began with the frontal area, to here to the cheek and to the neck, we can see a lot of wrinkles here, lower eyelid fat pads, upper eyelid fat pad, horizontal wrinkles. And also one of the most important things here is the frontal ptosis, the frontal of the eyebrow. The ptosis of the eyebrow produce this sad and tired expression. And you are going to see in all these preoperative pictures, the patient is going to have these frontal frowns, but she has because she needs to put the eyebrow in a position that she can see. And almost this produces a lot of pain, head pain. Also we can see here a photo skin damage. In this view we can see the same, the frontal frowns spasm that I talk about, the lack of definition of the mandibular jaw. And what I propose to this patient is a full face facial rejuvenation, natural. I propose endoscopic brow lift to reposition the eyebrow, and with this eyebrow reposition, she's going to look younger, youth, and her expression will be completely different. Yes, it's a change of the expression when one reposition of the tail of the eyebrow. And this procedure I perform through 3 minimal incisions inside of the hairline. Also, I'm going to perform my personal eyelid technique without skin resection, a face and neck lift that many patients are afraid about the scar here, but you can see in all my patients that they present like a facelift. You can see the naturality of the scar that is almost imperceptible. The ptosis of the neck, the lack of the definition of the jawline, the furrows and the spans of the frontalis muscle that I talk about. If you put Botox here, the patient is going to be in this way. It's a hard effort for the frontal and produce a lot of head pain. You can see here the lower eyelid fat pads. Okay, as you know, the conventional blepharoplasty resect skin in the upper eyelid, in the lower eyelid, but left a scar and produce also malposition. The personal technique I develop do not resect the skin, just tightening with the energy of carbon dioxide laser. But it's not only important to have a carbon dioxide laser. I acquired 30 years of experience using this kind of technology, and you are going to see in my website hundreds of videos of facial rejuvenation using this machine. And you can think, you think how it is possible that the conventional resective blepharoplasty improve all this area, resecting a thin skin from the lower eyelid. It is impossible. You can see the tired look, the spasm of the frontalis to keep in upward position of the eyebrow. Here, the spasm, but the periorbital, all these wrinkles. Okay, then we are going to see when the patient said, how is the recovery? The recovery from the endoscopic brow lift is very fast. 7 days generally the patient are perfect. Then the recovery of my personal technique of the upper and lower eyelid blepharoplasty without skin is very fast. The recovery of the facelift is very fast. In 7 days you are perfect. What take time to recover is the carbon dioxide laser, because produce an ablation and stimulation the collagen, and the patient are able to recover in 7 days or take longer, 2, 3, 4 months. If the patient have a big photo damage and the patient have time to recovery, generally prefer to perform, like to this patient, a strong carbon dioxide laser. And this patient is going to have a time with the scabs, generally takes 7 to 10 days. If you are lower, take only 5 days. Then come a process of redness. If you are performing a low energy, the redness lasts 20 days. But if you perform a strong carbon dioxide laser, redness can last 3-4 months. But the contraction of the skin is higher. Many patients are afraid of carbon dioxide laser. It's not painful. But after the procedure, they say, wow, are afraid. I can assure you that 30 years of performing this procedure, the carbon dioxide laser left an unbelievable result. But the energy must be adapted, not only to photo damage, to the personal life of each patient. If the patient needs to go to work in 10 days, I can perform a big energy of carbon dioxide laser, because I'm going to remove a lot of wrinkles, but the patient is not able to go to work soon. This patient is retired, asked me just for one procedure. She told me, please do to me a strong carbon dioxide laser. For me, it's the last time you can do what do you want if my face let me nice, natural as you, but I can support. Here you can see all of my patients said, no, I don't want fillers in the lips. No, because it's no, it's not unnatural. You can see this is an old lip, because the photo damage, because have no vertical pillars, because have no definition of the cupid arch. then it is absolutely necessary during this procedure to put a syringe of hyaluronic acid. Here you can see a lot of wrinkles, flaccidity of the upper eyelid, flaccidity and wrinkle of all periorbital area. And again and again and again. It is impossible resecting skin, rejuvenate all this area. Just only you want to have complication. Complication here of the scar, lower eyelid malposition, but with carbon dioxide laser you can improve all the area and improve. You can see flaccidity here, and this is the patient 4 days after the procedure. You can see, don't pay attention at this moment to the scabs and everything. Pay attention to what I'm saying. You can see the endoscopic brow lift, no edema, no hematoma. You can see my personal technique of the upper and lower lid, no scars. You can see a nice definition of the facelift. Here is the stitches. This is 4 day post-op. You imagine is a day patient I perform a soft carbon dioxide laser. This patient is going to be unbelievable, but I can remove all the. And here is 7 days. 7 days you can see the change. This is nearly 30-40 days. Redness that lasts in this patient 3 to 4 months and was lowering the intensity. And this is after 6 months, I think so. You can see no wrinkles, the tightening of the skin, nice lip, the contraction of the skin, the reposition of the eyebrow. You can see a lot of spasm, here not spasm. You can see here a lot of lower and upper lid flaccidity. You can see here no flaccidity. You can see the improvement of this area. You can see a nice jawline definition, a nice neck definition, a nice lip definition, an improvement of the nose that almost is imperceptible. And you can see a lot of wrinkles here, and you can see almost no wrinkles and no scar here, with a nice definition of the vertical jawline, the transversal jawline, and here, and a nice neck. No scars, nice lips, nice definition, a good position of the eyebrow, a lot of few treatments that don't leave scars but give a natural, wonderful, beautiful results. This is what I'm doing all the time. This is for what people all around the world come to here to my clinic and stay here 14 days, sometimes 10 days, another 3 weeks, and I perform all this treatment to people around the world. They send me pictures from another countries. My personal send the test that they need to perform in their country and come back 1 or 2 days before the procedures and stay with us 7, 10, 14 days. And if you're looking for in the web around the world, you are not going to see this kind of procedures. Periorbital rejuvenation without skin resection using laser technology. You are going to see blepharoplasty with laser technology, but they are cutting the skin with laser. I not cut the skin, just I rejuvenate the skin, improve the quality of the skin without any skin resection. The lower eyelid fat pad are removing for transconjunctival incision. The upper eyelid fat pad I are removing for stab incision. No scars from here to here, nothing. The nice definition of the jawline. This is what we call full face facial rejuvenation. Reposition of the eyebrow, rejuvenation of the upper and lower eyelid, rejuvenation of the periorbital area. Here we can see a lack of volume of the malar area, and this is the stop between this is called a lower eyelid cheek junction. You can see here there is not lower eyelid cheek junction. The cheek and the lower eyelid continue like one unit, and this is youthful. And almost all the patients I perform fillers here with hyaluronic acid because there is an interrelationship between the lower eyelid and the malar area that is very important. Few patients understand the importance of the malar and the cheek area. Meanwhile, we getting older, we lose volume here, and just in almost all the patients I tighten the skin of the periorbital area, but also add hyaluronic acid of fat. I prefer hyaluronic acid to the malar and the cheek in order to give this young natural look where the cheek continue with the lower eyelid almost without lower lid cheek junction. It is impossible with conventional blepharoplasty to get this result. You can look for in internet, whatever. For this reason, come patients from France, all Europe, United States, Latin America, because I developed this technique. Also in Spanish Wikipedia, in blepharoplasty appear like my no-invasive blepharoplasty technique, and I have a lot of paper recognition from president of important surgery. They asked me to give this lecture around the world. But plastic surgeons generally are not prepared, they have no training. I'm a plastic surgeon, I have training in general surgery, reconstructive surgery, aesthetic surgery, but I make my own road way using carbon dioxide laser and other technologies. Okay, you can see this. The future of periorbital rejuvenation is no skin resection at all, because the name of blepharoplasty is wrong, because the procedure of conventional blepharoplasty is wrong. This is the future for another plastic surgeon, but for me, I performed this near 30 years. Thousands of patients treating with these unbelievable results. And remember, 1 cc of hyaluronic acid in the lips make a big difference, and 2 cc in each malar area of hyaluronic acid make a big difference. To come to my clinic and say, no, I don't want to make a filler in the cheek because it's unnatural. No, you lost volume of the cheek, and your cheek need increase the volume, and also you lose volume in the lips and you need to improve it. Okay, this is what I'm doing. You can see the contraction of the skin. You can not see a scar here, no scar here, and all periorbital rejuvenation with carbon dioxide laser, no skin resection, no scar, natural result, a complete full rejuvenation, and this is what I'm done. Have a nice day.